so good to see you here.
Hi, how's it going?
Good, how are you?
Good.
I've been meaning to talk to you about Chris.
Right? It's been on my mind too. We're making no progress.
I feel the same way. The fluency shaping techniques are not working. I'm so tired of telling him to breathe correctly and relax.
Me too.
I saw an Instagram post about a stuttering coach recommending a more penalizing technique that was backed by behavior research. Do you think we should try it?
What was it?
It was about snapping his own wrist with a rubber band, and every time he stuttered, it's supposed to help him stop.
Maybe we could try adding some pain, and that way he thinks about his stutter every time before he stutters. Maybe it helps stop. I'll be right back, but when I get back, we can keep talking about it, and that way I get back before it starts.
Okay, no problem.
Did I just hear correctly? Are they discussing a punitive method for stuttering?
It sounds like they're considering having him snap his wrist every time he stutters. That doesn't sound right at all.
No, I'm gonna tell her something. Hi, sorry to bother you. I'm Betty. This is Sheila. We're both SLPs, and I couldn't help but hear you discussing with your friend about your challenges with stuttering and your client.
Yeah, I've been trying fluency shaping, but so far he hasn't responded as we hoped.
You know, with my experience, not all children recover from stuttering spontaneously. It's a gradual process.
You're right, and we also have to keep in mind he's a teen already, so if he hasn't recovered by now, the chances are that it's not going to go away on its own. And it's also important to incorporate different, techniques, if you will, and that can help us support and see some more progress, but I don't think it'll go away.
Yeah, the progress has been really slow with the fluency shaping. I'm really at my wit's end with it. Maybe the wrist snapping would work.
I don't know, using physical pain like a rubber band doesn't sound like a evidence-based approach, and it might not effectively address the underlying causes of stuttering, and it might even make it worse and have some negative psychological effects to it.
Yes, absolutely. It's important to consider evidence-based practice and the well-being of our clients. Have you explored other approaches? Sometimes a combination of different techniques or maybe a different therapeutic framework could be more effective for him.
Yeah, I haven't really explored much. What would you suggest?
Well, there's also stuttering modification that it basically works on reducing like that fear and anxiety that's associated with some stuttering moments, and sometimes this can help eliminate them, and it can also provide a more holistic approach for your client, which seems like he kind of needs that.
If not, there's also different cognitive behavioral strategies that can help address the emotional aspects that often accompany stuttering. It's about empowering your clients to manage their speech in a way that feels more comfortable and natural to them.
Yeah, that definitely sounds promising. I'll look into those options. Thank you both for stepping in, and I was really feeling stuck and frustrated.
Of course, you're welcome. We're here to learn and support each other. Stuttering therapy can be something challenging, and especially, if we're trying to work on that acceptance with our client. But there are effective methods that we can use to prioritize their well-being and just their overall, well-being as a person.
Yeah. If you ever want to discuss more strategies or ever just need someone to bounce off of ideas from, feel free to reach out. Collaborating among SLPs can make a world of a difference. Remember to be patient and empathetic because they're also just struggling with this as much as you are.
Yeah. Well, I appreciate that. Thank you again. I'll keep all of this in mind.
Of course. Should we head to our convention now?
Yes.
Guys.
It's about to start. Let's
Bye.
do that. Bye. Best of luck, Sam.
You too. Hi, Emma. I wanted to talk to you about Chris again.
Hi, Charlotte.
So I met two SLPs at a convention the other day, and it really talked me out of using the wrist snapping method.
Did they mention anything else we could use?
They did. They mentioned stuttering modification therapy, that it's supposed to reduce the fear and anxiety associated with stuttering.
Okay, I think I have heard of that approach. It's supposed to basically increase his awareness and modify the moment of stuttered speech rather than eliminating them altogether or trying to change it, or even worse, try to bring negative feelings to that.
Yeah.
So I really want to focus on building rapport and counseling motivation, as it can help with him developing self-monitoring skills as well.
Okay, I'm gonna take note of that too, so that I can work on it on his session. But yes, that's great. I feel like that'll really help him, and work on that acceptance and coping with the stuttering, which I feel like that's what he really needs.
Yeah, they also mentioned an acronym, MIDVAS, and it stands for Motivation, Identification, Desensitization, Variation, Approximations, and Stabilization.
Okay. So far, I copied them down. I feel like right now he's in the desensitization stage.
Yeah.
And I feel like maybe we can start working on that and work on like some of that exposure, work on those like scenarios that might, increase his stuttering and just overall like help him cope with that.
Yeah, I agree. I think this was a great conversation.
Thank you, of course.
I'll see you later.
See you.
In this role play, the focus was on guiding Sam away from the punitive measures towards evidence-based, client-centered approaches for stuttering therapy. The emphasis was on collaboration and support among SLPs.